Question 1. A nurse is caring for a patient who presents with acute chest pain, diaphoresis, and shortness of breath. The patient has a history of coronary artery disease, CAD. The ECG shows ST segment elevation. What is the nurse's first priority intervention? A. Administer oxygen and nitroglycerin as prescribed. B. Assess the patient for signs of stroke. C. Administer aspirin and call for an emergency intervention. D. Place the patient on continuous telemetry monitoring. Answer: A. Administer oxygen and nitroglycerin as prescribed. Rationale: oxygen and nitroglycerin are critical first-line treatments for a suspected STEMI to relieve ischemia and reduce the workload on the heart. Question 2. A nurse is caring for a patient with acute kidney injury, AKI, who is being treated with an ACE inhibitor. The patient's serum potassium is 6.8 milliequivalent per liter, and the ECG shows peak T waves. What is the nurse's first priority action? A. Administer sodium bicarbonate to correct the acidosis. B. Withhold the ACE inhibitor and notify the physician. C. Increase the fluid intake to flush out potassium. D. Prepare the patient for hemodialysis immediately. Answer: B. Withhold the ACE inhibitor and notify the physician. Rationale: hyperkalemia is a life-threatening complication of ACE inhibitors, and withholding the medication and notifying the physician is necessary to prevent cardiac arrhythmias. Question 3. A nurse is caring for a patient who has developed septic shock after abdominal surgery. The patient's blood pressure is 85/60 millimeter of mercury, and their heart rate is 120 BPM. What is the nurse's immediate priority intervention? A. Administer a bolus of normal saline. B. Start the patient on vasopressors. C. Initiate a broad-spectrum antibiotic regimen. D. Monitor the patient's urine output. Answer: A. Administer a bolus of normal saline. Rationale: fluid resuscitation with normal saline is the first step in managing septic shock to restore intravascular volume and improve perfusion to vital organs. Question 4. A nurse is caring for a patient with a post-operative deep vein thrombosis, DVT. The patient is on heparin therapy, and their activated partial thromboplastin time, APTT, is 90 seconds, normal range, 25 to 35 seconds. What is the nurse's first action? A. Increase the heparin infusion rate. B. Administer protamine sulfate to reverse heparin. C. Withhold the next dose of heparin and monitor closely. D. Notify the physician and continue with the prescribed dosage. Answer: C. Withhold the next dose of heparin and monitor closely. Rationale: an APTT of 90 seconds is elevated, indicating an increased risk of bleeding. Withholding the heparin and monitoring the patient closely is necessary to prevent complications. Question 5. A nurse is caring for a patient who is receiving a blood transfusion. The patient suddenly develops chills, fever, and a drop in blood pressure. What is the nurse's immediate priority action? A. Stop the transfusion and administer fluids. B. Administer acetaminophen as prescribed. C. Reassess the transfusion rate and continue. D. Call the physician and prepare for a second transfusion. Answer: A. Stop the transfusion and administer fluids. Rationale: the patient is exhibiting signs of a transfusion reaction, so the transfusion should be stopped immediately to prevent further complications. Question 6. A nurse is caring for a patient with advanced liver cirrhosis who develops a sudden increase in abdominal girth and shortness of breath. What is the priority intervention? A. Administer diuretics to reduce the fluid retention. B. Perform paracentesis to relieve the pressure. C. Increase the patient's protein intake. D. Place the patient in a low Fowler's position. Answer: B. Perform paracentesis to relieve the pressure. Rationale: sudden abdominal distension and shortness of breath may indicate ascites, a common complication of liver cirrhosis, which requires paracentesis to relieve pressure on the diaphragm and lungs. Question 7. A nurse is caring for a patient post-operatively who has developed a large hematoma at the surgical site. The patient is experiencing increasing pain and swelling. What is the nurse's priority intervention? A. Apply ice to the site and monitor vital signs. B. Administer pain medication and reassess. C. Notify the physician and prepare for surgical intervention. D. Elevate the affected limb and apply pressure. Answer: C. Notify the physician and prepare for surgical intervention. Rationale: a large hematoma can lead to complications such as pressure on surrounding tissues or a compromised blood supply, requiring immediate intervention. Question 8. A nurse is caring for a post-operative patient who is showing signs of hypovolemic shock, including tachycardia, hypotension, and decreased urine output. What is the nurse's first priority action? A. Administer oxygen therapy and elevate the legs. B. Increase the IV fluid rate and monitor the patient's response. C. Administer vasopressors as prescribed. D. Assess the surgical site for bleeding. Answer: B. Increase the IV fluid rate and monitor the patient's response. Rationale: fluid resuscitation is the priority in hypovolemic shock to restore circulating volume and improve tissue perfusion. Question 9. A nurse is caring for a patient who is receiving intravenous IV antibiotics and develops a new rash, fever, and hypotension. The patient has a known allergy to penicillin. What is the nurse's priority action? A. Administer an antihistamine as prescribed. B. Stop the antibiotic infusion and notify the physician. C. Administer a dose of epinephrine to reverse the reaction. D. Monitor the patient's vital signs and continue the infusion. Answer: B. Stop the antibiotic infusion and notify the physician. Rationale: the patient is likely having an allergic reaction to the antibiotic. The nurse should stop the infusion and notify the physician to prevent further complications. Question 10. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is experiencing increased shortness of breath. The patient's oxygen saturation is 88%. What is the nurse's first action? A. Increase the oxygen flow rate. B. Administer a bronchodilator as prescribed. C. Position the patient in high Fowler's position. D. Perform a peak flow measurement. Answer: B. Administer a bronchodilator as prescribed. Rationale: a bronchodilator is the first-line treatment to relieve bronchospasm and improve the patient's breathing. Question 11. A nurse is caring for a patient with hyperkalemia, potassium level 6.5 milliequivalent per liter, who is receiving potassium-sparing diuretics. What is the nurse's priority intervention? A. Administer sodium bicarbonate as prescribed. B. Monitor the patient's cardiac rhythm closely. C. Administer a potassium supplement as ordered. D. Increase the rate of intravenous fluids. Answer: B. Monitor the patient's cardiac rhythm closely. Rationale: hyperkalemia can lead to dangerous arrhythmias, so continuous cardiac monitoring is necessary to detect any changes in rhythm. Question 12. A nurse is caring for a patient receiving intravenous IV fluid resuscitation after severe dehydration. The patient develops crackles in the lungs and shortness of breath. What is the nurse's priority action? A. Increase the IV fluid rate to improve circulation. B. Assess the patient's blood pressure and pulse. C. Slow the infusion rate and notify the physician. D. Administer a diuretic to reduce fluid overload. Answer: C. Slow the infusion rate and notify the physician. Rationale: crackles in the lungs and shortness of breath suggest fluid overload. Slowing the infusion and notifying the physician is necessary to prevent complications. Question 13. A nurse is caring for a patient receiving chemotherapy. The patient develops a temperature of 101.4 degrees Fahrenheit and chills. What is the nurse's priority action? A. Administer acetaminophen as prescribed. B. Initiate blood cultures and start broad-spectrum antibiotics. C. Increase the patient's fluid intake. D. Administer an antiemetic to reduce nausea. Answer: B. Initiate blood cultures and start broad-spectrum antibiotics. Rationale: a fever in a neutropenic patient is a medical emergency, and broad-spectrum antibiotics should be started after blood cultures are taken to identify any infection. Question 14. A nurse is caring for a patient who has developed an air embolism during a central venous catheter insertion. The patient becomes tachycardic, hypotensive, and cyanotic. What is the nurse's first priority action? A. Administer oxygen and elevate the patient's legs. B. Call for emergency help and prepare for resuscitation. C. Stop the procedure immediately and remove the catheter. D. Assess the patient's cardiac rhythm and vital signs. Answer: A. Administer oxygen and elevate the patient's legs. Rationale: administering oxygen and positioning the patient with their legs elevated will help to prevent further embolic movement and improve circulation. Question 15. A nurse is caring for a patient with a newly diagnosed pulmonary embolism. The patient is experiencing sudden shortness of breath and pleuritic chest pain. What is the nurse's first priority action? A. Administer anticoagulants as prescribed. B. Administer oxygen therapy to improve oxygenation. C. Assess the patient's respiratory rate and effort. D. Monitor for signs of bleeding related to anticoagulant therapy. Answer: B. Administer oxygen therapy to improve oxygenation. Rationale: oxygen therapy is the priority to ensure adequate oxygenation and to prevent further hypoxia in a patient with a pulmonary embolism. Question 16. A nurse is caring for a patient with a history of alcohol abuse who is being treated for alcohol withdrawal. The patient begins to exhibit confusion, agitation, and visual hallucinations. What is the nurse's priority action? A. Administer lorazepam as prescribed. B. Assess the patient's blood alcohol level. C. Administer haloperidol for agitation. D. Notify the physician and prepare for sedation. Answer: A. Administer lorazepam as prescribed. Rationale: lorazepam is a benzodiazepine, which is the first-line treatment for alcohol withdrawal to prevent seizures and delirium tremens. Question 17. A nurse is caring for a patient with a history of asthma who is using a nebulizer for shortness of breath. After the treatment, the nurse notes a decrease in breath sounds and oxygen saturation. What should the nurse do first? A. Administer a second nebulizer treatment. B. Increase the oxygen flow rate. C. Contact the physician and report the findings. D. Assess the patient for signs of respiratory distress. Answer: D. Assess the patient for signs of respiratory distress. Rationale: assessing the patient's respiratory status is critical to understanding the cause of the oxygen desaturation and providing appropriate interventions. Question 18. A nurse is caring for a post-operative patient who is at risk for deep vein thrombosis, DVT. The patient is on heparin therapy. The nurse notes that the patient's APTT is 50 seconds, normal range, 25 to 35 seconds. What should the nurse do? A. Administer the prescribed dose of heparin. B. Withhold the heparin and monitor the patient closely. C. Increase the heparin dosage to achieve a therapeutic range. D. Notify the physician and administer vitamin K. Answer: B. Withhold the heparin and monitor the patient closely. Rationale: an APTT of 50 seconds is above the normal range, indicating the patient is at increased risk for bleeding. The heparin should be withheld, and the patient should be monitored. Question 19. A nurse is caring for a patient with a suspected stroke. The patient has left-sided weakness, slurred speech, and facial droop. The nurse anticipates administering which medication immediately? A. Thrombolytic therapy. B. Antihypertensive agents. C. Antiplatelet agents. D. Diuretics. Answer: A. Thrombolytic therapy. Rationale: thrombolytic therapy, e.g. alteplase, is used to dissolve clots in patients with acute ischemic stroke to restore blood flow to the brain. Question 20. A nurse is caring for a patient with severe burns who is receiving intravenous fluids for fluid resuscitation. The nurse notices that the patient's urine output is decreasing and their blood pressure is dropping. What is the nurse's priority action? A. Administer additional IV fluids. B. Notify the physician immediately. C. Monitor the patient's temperature. D. Administer a vasopressor. Answer: A. Administer additional IV fluids. Rationale: in burn patients, decreased urine output and hypotension are signs of fluid volume deficit, and immediate fluid resuscitation is necessary to improve circulation and organ perfusion. Question 21. A nurse is caring for a patient with severe hypovolemia after massive blood loss. The nurse notes that the patient is tachycardic and hypotensive. What is the nurse's first priority? A. Administer blood products as prescribed. B. Administer an intravenous bolus of normal saline. C. Start vasopressor therapy. D. Assess the patient's respiratory status. Answer: B. Administer an intravenous bolus of normal saline. Rationale: fluid resuscitation is the first step to restore circulatory volume and improve perfusion in a hypovolemic patient before other interventions are considered. Question 22. A nurse is caring for a post-operative patient who has developed a pulmonary embolism, PE. The patient is experiencing sudden shortness of breath, chest pain, and anxiety. What is the nurse's priority intervention? A. Administer oxygen therapy. B. Notify the physician and prepare for a CT scan. C. Administer a bronchodilator. D. Increase the patient's IV fluids. Answer: A. Administer oxygen therapy. Rationale: oxygen therapy is the priority intervention to improve oxygenation and prevent hypoxia in a patient with a pulmonary embolism. Question 23. A nurse is caring for a patient with a recent diagnosis of hyperthyroidism. The nurse notes that the patient is exhibiting nervousness, tachycardia, and a fine tremor. What is the nurse's most important action? A. Administer beta blockers to control the symptoms. B. Instruct the patient to take rest breaks throughout the day. C. Encourage the patient to increase caloric intake. D. Monitor the patient's blood pressure regularly. Answer: A. Administer beta blockers to control the symptoms. Rationale: beta blockers such as propranolol are used to manage symptoms of hyperthyroidism like tachycardia and tremors until definitive treatment, e.g. antithyroid drugs, can be initiated. Question 24. A nurse is caring for a patient with suspected bacterial meningitis. The nurse notes that the patient is exhibiting a positive Brudzinski sign. What does this indicate? A. Cerebral edema. B. A positive result for bacterial meningitis. C. Increased intracranial pressure. D. Risk for seizures. Answer: B. A positive result for bacterial meningitis. Rationale: a positive Brudzinski sign, where flexion of the hips occurs when the neck is flexed, is indicative of meningeal irritation, a sign of meningitis. Question 25. A nurse is caring for a patient receiving chemotherapy who has developed mucositis. What is the best intervention to alleviate the patient's symptoms? A. Administer analgesics and provide mouth care. B. Apply topical steroids to the mouth. C. Provide a high-protein diet to promote healing. D. Administer a sedative to promote rest. Answer: A. Administer analgesics and provide mouth care. Rationale: analgesics and mouth care, such as using saline rinses, help manage the pain and irritation caused by mucositis, which is a common side effect of chemotherapy. Question 26. A nurse is caring for a patient who is post-operative following a total hip replacement. The patient develops sudden shortness of breath and a feeling of impending doom. What should the nurse suspect? A. Pulmonary embolism, PE. B. Deep vein thrombosis, DVT. C. Atelectasis. D. Acute myocardial infarction. Answer: A. Pulmonary embolism, PE. Rationale: sudden shortness of breath and feelings of impending doom are classic signs of a pulmonary embolism, especially in post-operative patients. Question 27. A nurse is caring for a patient with suspected septic shock. The patient is hypotensive, tachycardic, and febrile. What is the priority action? A. Administer broad-spectrum antibiotics. B. Increase fluid intake and monitor output. C. Initiate vasopressor therapy. D. Administer antipyretics as prescribed. Answer: A. Administer broad-spectrum antibiotics. Rationale: early administration of antibiotics is crucial in septic shock to combat the infection and prevent organ failure. Question 28. A nurse is caring for a patient with a history of frequent urinary tract infections, UTIs. The patient develops new-onset confusion and dysuria. What is the nurse's priority action? A. Perform a urine culture and start antibiotics. B. Increase fluid intake and monitor symptoms. C. Provide acetaminophen for pain relief. D. Encourage the patient to ambulate to improve circulation. Answer: A. Perform a urine culture and start antibiotics. Rationale: new-onset confusion in elderly patients with UTIs is common and requires prompt antibiotic treatment based on urine culture results. Question 29. A nurse is caring for a patient with newly diagnosed heart failure. The patient is experiencing difficulty breathing and is on a low-sodium diet. What should the nurse monitor closely? A. Weight gain and fluid retention. B. Blood glucose levels. C. Serum potassium levels. D. Electrolyte levels, specifically sodium. Answer: A. Weight gain and fluid retention. Rationale: in heart failure, monitoring for weight gain and fluid retention is essential to assess for worsening heart failure and the need for adjustment in treatment. Question 30. A nurse is caring for a patient who is being discharged on warfarin therapy after a DVT. What is the most important teaching point regarding warfarin therapy? A. Avoid foods rich in vitamin K. B. Take the medication at the same time every day. C. Skip doses if you forget to take the medication. D. Only take warfarin when you feel unwell. Answer: A. Avoid foods rich in vitamin K. Rationale: vitamin K can interfere with the effectiveness of warfarin, so patients should be educated to maintain a consistent intake of vitamin K-rich foods. Question 31. A nurse is caring for a post-operative patient who is developing confusion, agitation, and hyperreflexia. The patient has a history of serotonin syndrome. What is the priority intervention? A. Administer an SSRI as prescribed. B. Administer a benzodiazepine to reduce agitation. C. Discontinue the serotonin receptor agonist immediately. D. Start an antipsychotic medication. Answer: C. Discontinue the serotonin receptor agonist immediately. Rationale: serotonin syndrome is caused by excessive serotonergic activity, and the first intervention is to stop the medication responsible for it. Question 32. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is experiencing an exacerbation. What is the nurse's priority intervention? A. Administer corticosteroids as prescribed. B. Monitor the patient's oxygen saturation levels. C. Encourage the patient to use pursed lip breathing. D. Administer a bronchodilator as prescribed. Answer: D. Administer a bronchodilator as prescribed. Rationale: bronchodilators are the first-line treatment to relieve bronchospasm and improve the patient's breathing during an exacerbation of COPD. Question 33. A nurse is caring for a post-operative patient with a suspected myocardial infarction, MI. The patient suddenly develops a decreased level of consciousness and a systolic blood pressure of 70 millimeters of mercury. What is the nurse's immediate priority? A. Administer IV fluids to increase perfusion. B. Administer oxygen to improve oxygenation. C. Prepare the patient for intubation. D. Call a rapid response and notify the physician. Answer: D. Call a rapid response and notify the physician. Rationale: sudden decreased consciousness and hypotension in a patient with suspected MI suggest hemodynamic instability, requiring immediate intervention. Question 34. A nurse is caring for a patient who has been diagnosed with acute pancreatitis. The patient develops hypotension, tachycardia, and decreased urine output. What is the priority action? A. Administer IV fluids to restore circulating volume. B. Administer morphine for pain relief. C. Increase the patient's potassium intake. D. Start broad-spectrum antibiotics. Answer: A. Administer IV fluids to restore circulating volume. Rationale: the primary concern in acute pancreatitis with signs of hypovolemic shock is fluid resuscitation to prevent organ failure. Question 35. A nurse is caring for a patient who has been diagnosed with deep vein thrombosis, DVT, and is receiving heparin therapy. The patient suddenly develops shortness of breath, chest pain, and hypotension. What should the nurse suspect? A. Pulmonary embolism. B. Acute myocardial infarction. C. Hemorrhagic stroke. D. Cardiac tamponade. Answer: A. Pulmonary embolism. Rationale: these symptoms are consistent with a pulmonary embolism, which is a complication of DVT. Question 36. A nurse is caring for a patient who is receiving chemotherapy and develops mucositis. What is the most appropriate intervention to manage this side effect? A. Administer opioid analgesics for pain control. B. Recommend alcohol-based mouthwash. C. Encourage the patient to brush teeth after meals. D. Offer bland, soft foods and warm saltwater rinses. Answer: D. Offer bland, soft foods and warm saltwater rinses. Rationale: providing mouth care with warm saltwater rinses and offering soft foods help relieve discomfort from mucositis caused by chemotherapy. Question 37. A nurse is caring for a patient with chronic kidney disease, CKD, who has developed uremic frost. What is the nurse's priority intervention? A. Administer dialysis as prescribed. B. Increase fluid intake to flush out toxins. C. Administer sodium bicarbonate for metabolic acidosis. D. Prepare the patient for a kidney transplant. Answer: A. Administer dialysis as prescribed. Rationale: uremic frost indicates severe kidney dysfunction and requires prompt dialysis to manage the accumulation of waste products. Question 38. A nurse is caring for a post-operative patient who develops sudden sharp chest pain, dyspnea, and tachypnea. The nurse suspects a pulmonary embolism, PE. What is the nurse's first priority action? A. Administer an anticoagulant as prescribed. B. Administer oxygen therapy. C. Call the physician for immediate intervention. D. Perform a chest X-ray to confirm the diagnosis. Answer: B. Administer oxygen therapy. Rationale: oxygen therapy is the first intervention to improve oxygenation in a patient with suspected PE to prevent hypoxia. Question 39. A nurse is caring for a patient who has been prescribed warfarin for anticoagulation. The patient's INR is 5.0. What is the nurse's first priority action? A. Administer vitamin K as prescribed. B. Increase the dose of warfarin. C. Monitor the patient for signs of bleeding. D. Administer aspirin to prevent clot formation. Answer: A. Administer vitamin K as prescribed. Rationale: an INR of 5.0 is above the therapeutic range and increases the risk of bleeding. Vitamin K is administered to reverse the effects of warfarin. Question 40. A nurse is caring for a patient with septic shock. The patient is experiencing decreased urine output, hypotension, and tachycardia. What is the nurse's priority action? A. Administer vasopressors as prescribed. B. Increase fluid resuscitation. C. Start broad-spectrum antibiotics. D. Monitor the patient's blood glucose. Answer: B. Increase fluid resuscitation. Rationale: in septic shock, fluid resuscitation is the priority to restore circulating volume and improve perfusion to vital organs. Question 41. A nurse is caring for a post-operative patient who develops signs of bleeding at the surgical site. The patient's hemoglobin is 7.0 gram per deciliter, and the patient is tachycardic and hypotensive. What is the nurse's first priority action? A. Administer a blood transfusion. B. Increase the IV fluid rate. C. Monitor the patient's vital signs. D. Notify the physician immediately. Answer: D. Notify the physician immediately. Rationale: these signs suggest significant blood loss, and immediate intervention is needed to manage the bleeding and restore hemodynamic stability. Question 42. A nurse is caring for a patient who has developed an air embolism during the insertion of a central venous catheter. The patient is hypotensive and tachycardic. What is the nurse's priority action? A. Place the patient in a left lateral decubitus position with their head lower than their chest. B. Administer oxygen therapy and increase the IV fluids. C. Start cardiopulmonary resuscitation, CPR. D. Call for immediate assistance and notify the physician. Answer: A. Place the patient in a left lateral decubitus position with their head lower than their chest. Rationale: the left lateral decubitus position helps trap the air in the right atrium, preventing it from entering the pulmonary circulation, while the head-down position helps facilitate air absorption. Question 43. A nurse is caring for a patient with acute respiratory distress syndrome, ARDS, on mechanical ventilation. The nurse observes a sudden increase in peak inspiratory pressure. What is the nurse's first priority? A. Increase the tidal volume to improve ventilation. B. Assess the patient's respiratory status and check for signs of pneumothorax. C. Increase the ventilator rate to improve oxygenation. D. Administer sedatives to reduce agitation. Answer: B. Assess the patient's respiratory status and check for signs of pneumothorax. Rationale: a sudden increase in peak inspiratory pressure could indicate a complication such as a pneumothorax, which requires immediate assessment. Question 44. A nurse is caring for a post-operative patient who has been receiving opioid analgesics for pain management. The patient develops a respiratory rate of 6 breaths per minute. What is the nurse's priority action? A. Administer naloxone as prescribed. B. Increase the oxygen flow rate. C. Stop the opioid infusion immediately. D. Perform a full neurological assessment. Answer: A. Administer naloxone as prescribed. Rationale: a respiratory rate of 6 breaths per minute suggests opioid overdose, and naloxone is the antidote to reverse the effects of the opioid and restore respiratory function. Question 45. A nurse is caring for a patient with a history of alcohol abuse. The patient develops tremors, agitation, and confusion 48 hours after admission. What is the nurse's priority action? A. Administer lorazepam as prescribed. B. Administer vitamin K to correct deficiency. C. Increase oral intake of fluids and nutrition. D. Notify the physician and prepare for transfer to a psychiatric unit. Answer: A. Administer lorazepam as prescribed. Rationale: these symptoms are indicative of alcohol withdrawal, and lorazepam is the treatment of choice to prevent complications like seizures and delirium tremens. Question 46. A nurse is caring for a patient who has developed a suspected stroke. The patient is exhibiting facial droop, slurred speech, and weakness in one arm. What is the nurse's first priority? A. Administer a thrombolytic agent as prescribed. B. Perform a thorough neurological assessment. C. Initiate a code stroke and notify the stroke team. D. Position the patient in a low Fowler's position. Answer: C. Initiate a code stroke and notify the stroke team. Rationale: prompt intervention is critical in stroke care to administer thrombolytics within the window of opportunity and prevent long-term damage. Question 47. A nurse is caring for a post-operative patient who develops signs of hemorrhage, including an increased heart rate, decreased blood pressure, and pale skin. What is the priority action? A. Administer IV fluids and monitor vital signs. B. Administer blood products as prescribed. C. Apply pressure to the surgical site to stop the bleeding. D. Notify the surgeon immediately. Answer: D. Notify the surgeon immediately. Rationale: active bleeding after surgery requires immediate surgical intervention to address the source of hemorrhage and stabilize the patient. Question 48. A nurse is caring for a patient receiving long-term corticosteroid therapy. The patient reports increased fatigue, weakness, and nausea. What is the priority action? A. Check the patient's blood glucose level. B. Administer potassium supplements. C. Notify the physician and request a laboratory evaluation of adrenal function. D. Provide antiemetic medication as prescribed. Answer: C. Notify the physician and request a laboratory evaluation of adrenal function. Rationale: these symptoms may indicate adrenal insufficiency due to long-term corticosteroid use, requiring prompt assessment and management. Question 49. A nurse is caring for a patient post-surgery who has developed sudden shortness of breath, chest pain, and tachycardia. The nurse suspects a pulmonary embolism. What is the nurse's first action? A. Administer a bronchodilator. B. Apply oxygen therapy and notify the physician. C. Perform a complete respiratory assessment. D. Start an intravenous line for fluid administration. Answer: B. Apply oxygen therapy and notify the physician. Rationale: oxygen therapy is the immediate priority in cases of suspected pulmonary embolism to improve oxygenation while preparing for further interventions. Question 50. A nurse is caring for a patient with a history of chronic obstructive pulmonary disease, COPD. The patient is receiving a nebulizer treatment, and the nurse notes that the patient's SpO2 has dropped to 88%. What is the nurse's priority intervention? A. Increase the oxygen flow rate. B. Administer a corticosteroid as prescribed. C. Reassess lung sounds and respiratory status. D. Provide a sedative to calm the patient. Answer: C. Reassess lung sounds and respiratory status. Rationale: it is important to assess the patient's lung sounds and respiratory status to determine the cause of the desaturation and address it appropriately. Question 51. A nurse is caring for a patient who has developed hypovolemic shock after significant blood loss. The patient's heart rate is 120 bpm and their blood pressure is 85/60 millimeters of mercury. What is the nurse's priority intervention? A. Administer IV fluids to restore volume. B. Start vasopressors as prescribed. C. Monitor the patient's urine output. D. Administer blood products as prescribed. Answer: A. Administer IV fluids to restore volume. Rationale: fluid resuscitation is the first priority in hypovolemic shock to restore circulating blood volume and improve perfusion. Question 52. A nurse is caring for a patient with liver failure. The nurse observes new-onset confusion, irritability, and hysterexis. What is the most likely cause of these symptoms? A. Hepatic encephalopathy. B. Cerebrovascular accident stroke. C. Electrolyte imbalance. D. Hypoxia from respiratory failure. Answer: A. Hepatic encephalopathy. Rationale: hepatic encephalopathy is a common complication of liver failure, resulting from the accumulation of toxins like ammonia in the bloodstream. Question 53. A nurse is caring for a post-operative patient with a history of hypertension. The patient suddenly becomes hypotensive, tachycardic, and anxious. What is the nurse's priority action? A. Administer a blood transfusion. B. Administer IV fluids and assess for bleeding. C. Notify the physician immediately. D. Apply oxygen therapy and monitor vital signs. Answer: B. Administer IV fluids and assess for bleeding. Rationale: hypotension and tachycardia may suggest internal bleeding or fluid loss, so IV fluids should be administered while assessing for the source of bleeding. Question 54. A nurse is caring for a patient with suspected meningitis. The patient has a positive Brudzinski sign. What does this indicate? A. Increased intracranial pressure. B. Meningeal irritation due to infection. C. Risk for seizures due to a brain tumor. D. Risk for pulmonary embolism. Answer: B. Meningeal irritation due to infection. Rationale: a positive Brudzinski sign indicates meningeal irritation, which is a hallmark of meningitis, especially bacterial meningitis. Question 55. A nurse is caring for a patient with severe asthma who is experiencing an exacerbation. The patient is not responding to the initial albuterol treatment. What is the nurse's next priority action? A. Administer a corticosteroid. B. Administer another dose of albuterol. C. Initiate high-flow oxygen therapy. D. Notify the physician and prepare for intubation. Answer: A. Administer a corticosteroid. Rationale: in severe asthma exacerbations, corticosteroids help reduce inflammation and improve the response to bronchodilators. Question 56. A nurse is caring for a patient post-lumbar puncture. The patient develops a headache, nausea, and vomiting. What is the nurse's first priority action? A. Administer acetaminophen for pain relief. B. Apply a blood patch to the puncture site. C. Increase the patient's fluid intake. D. Monitor the patient for signs of infection. Answer: B. Apply a blood patch to the puncture site. Rationale: a post-lumbar puncture headache is often caused by cerebrospinal fluid leakage, and a blood patch can help seal the leak and alleviate the headache. Question 57. A nurse is caring for a patient with severe liver cirrhosis who has developed ascites. The nurse notes that the patient has developed new-onset dyspnea. What is the most appropriate intervention? A. Administer diuretics as prescribed. B. Perform paracentesis to remove fluid. C. Encourage the patient to cough and deep breathe. D. Increase the patient's fluid intake. Answer: B. Perform paracentesis to remove fluid. Rationale: ascites with new-onset dyspnea suggests that the fluid has accumulated in the abdomen, pressing on the diaphragm. Paracentesis is necessary to relieve this pressure. Question 58. A nurse is caring for a patient who is post-operative after a total knee replacement. The patient develops sudden, severe chest pain and tachycardia. The nurse suspects a fat embolism. What is the first priority action? A. Administer oxygen therapy. B. Administer heparin as prescribed. C. Assess the patient's blood pressure and pulse. D. Notify the physician immediately. Answer: A. Administer oxygen therapy. Rationale: oxygen therapy is the priority to ensure adequate oxygenation, as a fat embolism can cause respiratory distress and hypoxia. Question 59. A nurse is caring for a patient who is post-operative following a hip replacement. The patient develops sudden pain, swelling, and redness in one leg. What should the nurse suspect? A. Deep vein thrombosis, DVT. B. Pulmonary embolism, PE. C. Hematoma at the surgical site. D. Wound infection. Answer: A. Deep vein thrombosis, DVT. Rationale: pain, swelling, and redness in one leg post-operatively are signs of DVT, which requires immediate intervention to prevent a pulmonary embolism. Question 60. A nurse is caring for a patient who is receiving total parenteral nutrition, TPN. The nurse notes that the patient has developed a temperature of 101 degrees Fahrenheit, and the TPN solution has expired. What is the priority intervention? A. Administer antipyretics as prescribed. B. Notify the physician and change the TPN bag immediately. C. Administer broad-spectrum antibiotics. D. Discontinue the TPN and monitor the patient. Answer. B. Notify the physician and change the TPN bag immediately. Rationale. Expired TPN solutions can lead to infection and should be replaced immediately. The temperature increase may also indicate a potential infection. Question 61. A nurse is caring for a patient with severe burns who is receiving IV fluids for resuscitation. The patient's urinary output is 10 milliliters per hour. What is the nurse's priority action? A. Increase the IV fluids to improve urine output. B. Notify the physician immediately. C. Assess for signs of fluid overload. D. Administer diuretics as prescribed. Answer. B. Notify the physician immediately. Rationale. Decreased urine output after burn injury may indicate inadequate fluid resuscitation or renal failure, and the physician should be notified immediately. Question 62. A nurse is caring for a patient who has been diagnosed with type 1 diabetes. The patient is exhibiting signs of hypoglycemia, including sweating, shakiness, and confusion. What is the first action the nurse should take? A. Administer 25 grams of glucose orally. B. Administer insulin as prescribed. C. Administer 50% dextrose IVD. Reassess the patient's blood glucose in 30 minutes. Answer. A. Administer 25 grams of glucose orally. Rationale. For hypoglycemia, the first step is to administer glucose oral to rapidly raise the blood sugar level. Question 63. A nurse is caring for a patient with acute respiratory distress syndrome, ARDS, on mechanical ventilation. The nurse notices a decrease in oxygen saturation and high peak inspiratory pressures. What is the nurse's priority action? A. Increase the oxygen flow rate. B. Suction the patient's airway to remove secretions. C. Reposition the patient and reassess. D. Administer a sedative to relax the patient. Answer. B. Suction the patient's airway to remove secretions. Rationale. Increased peak inspiratory pressures and desaturation may indicate airway obstruction from secretions, which should be cleared through suctioning. Question 64. A nurse is caring for a patient post-laparotomy who is experiencing sudden, severe abdominal pain, and the abdomen is rigid and distended. What is the nurse's priority action? A. Administer pain medications as prescribed. B. Assess for signs of peritonitis and notify the physician. C. Increase the patient's IV fluid rate. D. Encourage the patient to ambulate to relieve the pain. Answer. B. Assess for signs of peritonitis and notify the physician. Rationale. Rigid and distended abdomen with sudden severe pain may indicate peritonitis, a surgical emergency requiring immediate physician intervention. Question 65. A nurse is caring for a patient with a history of heart failure who is receiving digoxin. The patient develops nausea, vomiting, and visual disturbances. What should the nurse assess first? A. The patient's serum potassium level. B. The patient's heart rate and rhythm. C. The patient's blood pressure. D. The patient's renal function. Answer. B. The patient's heart rate and rhythm. Rationale. Digoxin toxicity often presents with gastrointestinal symptoms and visual disturbances, but the nurse should first assess the patient's heart rate and rhythm due to the risk of arrhythmias. Question 66. A nurse is caring for a patient with a history of seizures. The patient experiences a generalized tonic-clonic seizure. What is the nurse's priority intervention during the seizure? A. Administer anticonvulsant medications. B. Protect the patient's airway and prevent injury. C. Assess the patient's level of consciousness. D. Restrain the patient to prevent harm. Answer. B. Protect the patient's airway and prevent injury. Rationale. The priority during a seizure is to ensure the patient's airway is open and to prevent injury. Restraint is contraindicated, and assessment can occur after the seizure has subsided. Question 67. A nurse is caring for a patient with severe anemia. The patient becomes increasingly fatigued, tachycardic, and hypotensive. What is the nurse's immediate priority action? A. Administer oxygen therapy. B. Administer blood products as prescribed. C. Monitor the patient's hematocrit and hemoglobin. D. Increase the IV fluid rate to improve circulation. Answer. B. Administer blood products as prescribed. Rationale. The priority in severe anemia is to replace the lost blood volume with blood products to improve oxygen carrying capacity and restore hemodynamic stability. Question 68. A nurse is caring for a patient who has just been prescribed warfarin. What is the most important teaching point for the patient? A. Avoid foods high in vitamin K. B. Take your medication only if you feel unwell. C. You can stop the medication when you feel better. D. Increase your fluid intake to prevent dehydration. Answer. A. Avoid foods high in vitamin K. Rationale. Vitamin K can interfere with warfarin's anticoagulant effects, so it's important to maintain a consistent intake of vitamin K-rich foods. Question 69. A nurse is caring for a patient post-operative from a hip replacement who is at high risk for deep vein thrombosis, DVT. What is the most effective intervention to prevent DVT? A. Administer heparin as prescribed. B. Apply compression stockings and encourage early ambulation. C. Administer aspirin to reduce clot formation. D. Increase the patient's fluid intake. Answer. B. Apply compression stockings and encourage early ambulation. Rationale. Early ambulation and compression stockings are the most effective methods for preventing DVT after surgery. Question 70. A nurse is caring for a patient with pneumonia who is receiving oxygen therapy. The patient becomes increasingly drowsy and has a respiratory rate of 6 breaths per minute. What is the nurse's immediate action? A. Increase the oxygen flow rate. B. Administer naloxone if opioid overdose is suspected. C. Reposition the patient to promote better breathing. D. Contact the physician immediately. Answer. B. Administer naloxone if opioid overdose is suspected. Rationale. A respiratory rate of 6 breaths per minute suggests possible opioid overdose, and naloxone is the antidote to reverse respiratory depression. Question 71. A nurse is caring for a patient with a recent diagnosis of pulmonary hypertension. The patient presents with severe dyspnea, fatigue, and swelling in the legs. What is the nurse's priority intervention? A. Administer a diuretic as prescribed. B. Administer oxygen therapy to improve oxygenation. C. Encourage the patient to rest in a high Fowler's position. D. Monitor the patient's electrolytes regularly. Answer. A. Administer a diuretic as prescribed. Rationale. Diuretics are used to manage fluid retention in pulmonary hypertension, helping reduce symptoms of dyspnea and edema. Question 72. A nurse is caring for a patient who is receiving IV fluids and has developed new-onset swelling in the extremities and neck. The nurse notices that the IV site is cool and swollen. What is the nurse's priority action? A. Discontinue the IV and elevate the affected limb. B. Administer IV antibiotics to treat potential infection. C. Assess the patient's fluid status and increase the IV rate. D. Call the physician to adjust the IV medication. Answer. A. Discontinue the IV and elevate the affected limb. Rationale. Swelling, coolness, and swelling around the IV site suggest infiltration, and the IV should be discontinued to prevent further tissue damage. Question 73. A nurse is caring for a patient with severe dehydration due to vomiting and diarrhea. The patient is lethargic, hypotensive, and has a dry mouth. What is the nurse's first priority action? A. Administer oral rehydration solutions. B. Administer IV fluids to restore circulatory volume. C. Monitor the patient's electrolyte levels. D. Perform a full abdominal assessment. Answer: B. Administer IV fluids to restore circulatory volume. Rationale: in severe dehydration, especially with hypotension, IV fluids are the priority to restore intravascular volume and prevent shock. Question 74. A nurse is caring for a patient with a suspected cerebrovascular accident, CVA, who is experiencing weakness in the right arm and slurred speech. What is the nurse's priority intervention? A. Perform a complete neurological assessment. B. Administer thrombolytic therapy as prescribed. C. Call a stroke code and prepare for a CT scan. D. Monitor the patient's vital signs. Answer: C. Call a stroke code and prepare for a CT scan. Rationale: a suspected stroke requires immediate action, including calling a stroke code and preparing for imaging to determine the type of stroke and appropriate treatment. Question 75. A nurse is caring for a patient who is post-operative from a laparotomy and is experiencing sudden, severe abdominal pain, distension, and a fever. What is the most likely complication? A. Peritonitis. B. Pneumonia. C. Cardiac arrhythmia. D. Urinary tract infection UTI. Answer: A. Peritonitis. Rationale: sudden severe abdominal pain, distension, and fever following abdominal surgery are indicative of peritonitis, a serious complication that requires immediate intervention.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.